Hi, my name is Dr. David Perna. I'm a chiropractor at Back and Body Pain Relief in Springfield, New Jersey, and Back and Body Medical in New York City. So I've been doing these videos every few weeks with key interval time periods. I am a post-surgical disc replacement at C4, C5, and C5, C6, and oftentimes people have a lot of questions following surgery about recovery time, how to get back to activity, a lot of things that usually go unanswered. There is an excellent series of videos by a CrossFitter who also had a similar take on it online, and I think those were excellent. But I think my intervals are a little bit different in time periods, and I guess to give a perspective of a person not only just does CrossFit but does a couple other activities such as jiu-jitsu might come in handy for a different group of population. Also from the perspective of a clinician, and really giving you some answers from the perspective of a clinician also. However, it is often said sometimes our worst patients are ourselves, because we often say yeah but and try to be a little bit more have a couple exceptions in the normal rules of return to sport or return to lifting. So currently my time period is I've completed 8 weeks post-surgical disc replacement, again at C4, C5, and C5, C6. Today is actually week 9. I wanted to wait to week 9 so I can look at everything I did in week 8 and report back. I knew my plan going into week 8 way ahead of time, but I wanted to know how it went and be able to report it. So I had a plan at week 8 to return to CrossFit. However, to not do any Olympic lifting yet, to not have any restrictions for squats and front squats, but still no overhead squats, and currently not doing any handstand push-ups. I don't want any impact down on top of my head just yet. It went pretty well. I did break a little bit and do some power cleans the other day just to get a feel for it. This surgical scar is unfortunately right where my clean bar lands and is a little uncomfortable, and I'm gonna have to work on that. It is a little bit sensitive. I'm currently using an ollie bar with no knurling in the front. I did try some front squats one day prior to week 8. Between week 6 and week 8, I was starting to get lightly back in front squats, and it was knurling here. And to compensate for a sensitivity, I just placed a small towel over top, and it pretty much helped out. And again, these are the small little things I'm finding help out. The scar in the center is still a little bit more active looking than the side. I did discuss in a prior video that I'm using some silicone applicant gel you can buy at any Walgreens or CVS to reduce the scar. I think the center of the scar is actually bigger, because when I look at t-shirts that fit on my neck, it actually touches here more frequently if it's a regular collared shirt versus a V-neck. And I think that may be part of the deal of why that is showing up more. As far as jiu-jitsu goes, I went back at week 8. I used minimal live rep rolling so far. It was just drilling for all of week 8. I did do some careful live rolls this morning. I have the attitude right now, if anybody puts me in any sort of chokehold of any kind, whether it is with or without the using the gi, or if it's no gi with a choke, or even gi with a choke, that I would immediately tap and not fight it. Anything that would be involving putting my neck in an awkward position, I'd have to put my ego at the door and immediately tap, say, that's fine, let's reset, and let's try that again. I did go live a little bit today, and I told people, go ahead and do what you're gonna do, so they didn't have to worry about my neck. But if we get in a position that makes me feel uncomfortable, I'm gonna immediately tap, just shut it down right then, and we'll reset. I was back to work as a chiropractor in week 2. Frankly, the surgery, minus the discomfort swallowing, I was able to pretty much be pretty active right away. I did have to hold myself back. I did feel more fatigued after working after week 2, but by week 3, I was pretty much back without any fatigue. I do have no regrets from having the surgery. This surgery was a decision I made not too quickly. You are up against the clock if you have neurological deficit from compression of a nerve root, if you have weakness. There are some studies that suggest this surgery has to take place fairly quickly, and anything under a year has better outcomes. I did do physical therapy, chiropractic treatment, and acupuncture, decompression therapy, and laser leading up into the decision to make the surgery. I did have return of strength to about 70-ish%. It then got exacerbated through some activities I did and went back down again. I got the strength back right around the holidays. It is now May, right around the holidays, and something occurred, whether it was the traveling during the holidays, just having a cold or sneezing a lot, that caused it to get exacerbated again and weakness returned. It was at that point that I decided that if this was going to be an up again, down again thing, and hopefully it would return the strength intermittently, that I really had to do something about it. At no point did I feel like my ability to press was fully back. It was quite limited, and overhead pressing, military style pressing, was definitely limited. In the Olympic lifts, the snatch seemed to be more affected initially with the problem. I felt like my lockout overhead, oftentimes I'd have a soft elbow when locking out and I would fail the lift. The jerk actually did okay. It wasn't that terrible. Receiving and then getting under it and locking out was okay. Especially that I felt like it really made me stress my form to get under the bar and then lock out. I did feel like I had better positioning with a power clean than a full squat clean. I felt like the full squat clean often left me lacking the strength to hold it in the front rack position in a deep portion of the squat. Those were not the reasons I chose to do the surgery. However, there was some quality of life issues at hand. I did have concerns of the inability to get off the floor properly with my right arm, and I figured as I got older, I would need more than just one arm to get off the floor. My right arm alone was often too weak to get me completely off the floor without the use of my left arm. I also had difficulty carrying groceries in from the car. Hanging up items that were heavier, like a heavy coat or wet clothing, were very difficult. I often found myself tucking my elbow at my side and arching my back to lift instead of raising my arm up completely. Stuff like that, currently at the strength of my left arm, were concerning because I knew over time as I got older that I wouldn't have the strength I had. So if I was diminished then, how bad would it be in 10 years from then? The final stroke was when I was holding and trying to carry my child in front of me up to the bed, and I realized slowly, in about 10 or 15 seconds of carrying, my right arm went completely weak. It felt like it would fire, and then all of a sudden it would just die out, and the strength would be completely diminished at that point. And that was when I realized that this is truly a problem I needed to take care of. I did not do surgery because of localized pain and discomfort with range of motion. That was never my reasoning behind doing the surgery. And it was not because of loss of range of motion as well. I currently have a decent range of motion, a little bit further than I used to have. There is a hard end stop feel without discomfort. I don't feel as though I have the normal range of motion, but there is return of some range of motion back. Driving in a car, I notice now I'm able to turn to see my blind spots better to the right than the left. I still have to turn my body a little bit to look left, but the lack of range of motion I had to the right has been regained. I can look into my blind spot and the mirror. However, going left, I still have to turn my body a little bit to see into the blind spot. Other than that, everything is pretty well. I intend on increasing Olympic lifts at week 12, being able to go a little bit more live with jiu-jitsu at week 12 with some pressure on top of my head in positions during jiu-jitsu. Think weight on your forehead and things like that. I'm waiting and trying to limit that until week 12, which would be 3 months post-op. I will try to do a video 3 months post-op or shortly thereafter to tell you any gains of increased abilities I have. I can tell you I immediately already do see some increases objectively, not subjectively, but objective measures with my pressing motions, my overhead press. I'm already starting to come back to, but not fully back to, full strength in my right arm. I do not feel like it is any longer a limitation in bench press and overhead press. However, I was almost a year of not being able to press as heavy with both arms with a barbell, and my overhead press with my dumbbells, I did do more on my left than my right. My right is catching up to my left now. The right is the side that was weak. But with a year of not being able to push as hard with my right arm, I did have some limitations with my overhead. As you can imagine, it's almost like not working out hard for a full year. But it is catching up now and getting along. I'm thinking positively and thinking at 3 months, we should be almost at completely near the strength of my left shoulder with overhead pressing, and my bench is coming along fairly nicely without any discomfort in my neck. Again, I will post another video at about 3 months' time.